Hi, it's Miss Susita Koirala. Today I have chosen a topic of the homelessness boy whose name is Paul, and also today I'm going to present on the topic empathy and the existence of empathy in the healthcare, and also being a registered nurse in the future, how the empathy can be delivered to the nursing care. I'll be discussing that one, and also I'll be focusing some of the communication technique that can be used in the Paul's care. So let's start with empathy. Empathy is nurse ability to feel someone else feeling an emotion, and also putting oneself in the other's shoes and just see the world through from their perspective. So the empathy care can be given to the patient by knowing their need and preference and acting accordingly, help them to alleviate their pain and suffering. And also the numerous studies have shown that there is a positive correlation between empathy care and the positive health outcome. So being as a registered nurse, we come across so many people from the different age group and with from different cultural, social and economic backgrounds. So there is the existence of the empathy gap in the healthcare because the nurse is unable to understand from the patient perspective, and they are unable to provide the empathic care. So being as you complex human being, we quickly judge what we hear and see. Due to this, our unconscious judgment and valuation, it is affecting on our empathic care. So now let's talk about the Paul's background. So who is Paul? Paul is one of the typical teenager. He used to live with his parents, but his relationship always remained unhealthy with his parents because of his some of the behavior made always himself on trouble. So at the age of 60, he revealed to his parents that he was in relationship and that her girlfriend was pregnant. After knowing this, the family were totally unfavorable in his situation, and there was he had a feeling of rejection, and there was the extreme family duress and physical abuse. So after because of the disrupted family relationship and the parental lack of care and support, he became the homelessness. So after knowing the Paul's situation, of course the feeling was not good for me. So we are judging and labeling as a homelessness with our conscious or subconscious mind, and so the stereotyping that we are holding towards a certain group of people that prevent us to provide the empathic care in the healthcare. Thus, however, we being as a nurse says, we are bound by the professional code of conduct, and we are in any cost we are not providing the non-judgmental judgmental care to the certain group of people. Thus, practicing empathic care and person-centered approach will help to close the empathy gap in the health existing in the healthcare. So now let's talk about some of the communication techniques that can be used in the pulse care. First, I'll talk about some of the verbal communication. So verbal communication is understanding the patient need and preference, and that can be delivered in oral and written form. Okay, let's say some of the examples such as active listening, nurse's voice, clarity of speech, and the empathic language can be used in the nursing care. Such as for the Paul, active listening is listening to his what he has to say rather than jumping into the conclusion. And also we can use the empathic language such as I feel sorry that it happened to you. This kind of empathic word will help to heal to the homelessness people like Paul. And also some of the non-verbal techniques are such as that is the body language, and which shows the nurse's attitude, behavior and attitude. Body language include like nurse's facial expression, eye contact and the warm touch. So just conveying this properly would help would help, and leaning forward while conversation would help the patient to feel being respected in their care. And also in conclusion, I would like to say nurses should challenge their own stereotype and prejudice to give the efficient care in the nursing care, and also they have to practice the positive attitude care. So just giving effective communication help to build the good relationship between nurse and patient in the future and in the healthcare industry. Thank you.